And we have some good news on that front tonight. More than 28,000 doses will be sent to hospitals across our state, including several here in Central Florida.
But the state is asking hospitals to set those doses aside for a specific group of people. Deanna Albritton is showing us how it will help people under the age of 65 who are medically vulnerable.
5 hospitals in Central Florida will be getting those doses, but people will have to be patient because those hospitals still need to figure out who exactly they deem medically vulnerable and how they'll get them access to the vaccine.
It's a sign that our advocacy efforts are working.
28,500 new doses to these 27 hospitals statewide next week. It's the response to a pressure campaign of emails, calls, and interviews.
It's very, very frustrating.
From people who have significant underlying conditions and are very vulnerable to COVID-19.
My white blood counts are so low. I'm considered neutropenic, so I can't catch anything.
We told you Thursday how despite all the vaccination sites in Lake County, breast cancer patient Nicole Campbell couldn't get vaccinated because she's not over 65. But the state had cut hospitals, the only place medically vulnerable people can get vaccinated, out of its distribution model. That has now changed.
What we know is that when people speak out, they bravely tell their stories. Sometimes it can make a difference.
Now, the Florida Department of Emergency Management confirms the state is strongly encouraging hospitals to use those 28,500 doses to vaccinate that population. In Central Florida, that includes ORMC, Advent Health, Holmes Regional, Palm Bay Hospital, and Lakeland Regional. But this issue?
We don't feel like there's any source of information where we can go and say, okay, yes, he absolutely qualifies.
Unfortunately, that hasn't changed.
The state has stayed out of the business of defining what they deem to be extremely vulnerable to COVID-19.
State Representative Guillermo Smith, who's been pushing the state for vaccines for the medically vulnerable, thinks Jackson Health's new framework for South Florida could be a good model. Jackson's vaccine eligibility includes their patients with one of these 7 underlying conditions.
We need to make sure that those hospitals publish clear guidelines for who is eligible and who is not eligible.
And the hope is that this round of doses is just a small start.
I definitely will push for it and advocate for it.
Now you can expect the debate will be fierce for who is considered medically vulnerable. That list you just saw doesn't include cases of severe developmental disability, like some cases of Down syndrome, which is associated with 3 times the risk of death. It also doesn't include people going through chemotherapy who have severely compromised immune systems. Deanna Albritton, WFTV Tonight.